We are just over 2 weeks into the West Virginia legislative session. A bill that has already been a point of contention is Senate Bill 460, which would allow religious or philosophical exemptions to the state's school vaccinations. Right now, West Virginia students are required to be vaccinated for 10 diseases like mumps, measles, and diphtheria, to name a few. But that could change if this bill passes down the line. Senate Bill 460 was introduced on behalf of Governor Patrick Morrisey and would allow parents and guardians to object to state-mandated vaccines by citing a religious or philosophical belief. State Senator Wakim-Chapman is the Senate Health and Human Resources Committee chairwoman. She says this bill wouldn't get rid of vaccines. It would just give parents and students more say in the matter.
What is happening now is our children in West Virginia are being denied an education because they have a religious or philosophical issue with a vaccine or all vaccines that are required for school. And so this just simply tells the schools that we need to let these children have an education of their choice. I just want to make it clear, the vaccines are not being taken away and they are still mandated for school. This just provides exemptions to that process.
West Virginia is one of 5 states in the country that currently does not allow religious or philosophical exemptions to vaccine requirements.
I believe in vaccines. I think I encourage everybody to get vaccinated. This is just to help the very small amount of people who will be exercising their religious or philosophical beliefs. Now, all of our surrounding states actually permit at least a religious exemption.
The Senate passed the bill last Friday, sending it to the House of Delegates with a vote of 20-12. State Senator Ryan Weld voted against the bill for a few different reasons. First, he has concerns about the philosophical exemptions.
Very few states allow for that. And by doing so here in West Virginia, I'm very concerned that we would see the outbreaks that other states with that same type of exemption have had when it comes to mumps, measles, rubella. These are entirely preventable diseases.
But Weld's bigger issue is with religious rights. He proposed an amendment that would have allowed schools run by churches to follow what their religion tells them to do. It was voted down.
The other concern that I have is that the bill, as it's written right now, isn't constitutional, because it requires private schools that are run by a church or religious organization to allow for these students who have not been vaccinated into their schools, even if vaccines and getting them is in line with the tenets of that religion's faith.
There are 24 Catholic schools throughout the Mountain State operating under the Diocese of Wheeling-Charleston. Bishop Mark Brennan sent a letter to legislators following the Senate vote, saying that the Catholic Church teaches that Catholics may take vaccines and vaccinate their children with a clear conscience. He went on to say, quote, "This bill purports to create an exemption from vaccination requirements permitting religious and philosophical exemptions to mandatory vaccination requirements in all schools. But the effect of the bill as written actually has the opposite effect, forcing parochial schools to accept another religion's teachings on vaccination of children, and therefore restricts religious freedom by limiting free exercise," end quote. It's not just parochial schools that are keeping a close eye on Senate Bill 460. Jenny Craig is the president of the Ohio County Education Association, and she says that passing this bill as is could result in losing teachers in a state that's already facing a shortage.
What I'm finding in talking to folks, not just teachers who are teaching now, but people who are thinking about entering the teaching profession, is it's not worth the risk. It's not worth the risk to have low pay and poor health care and to potentially bring home a very harmful disease to their very young children. Similarly, we have a lot of teachers who are within the retirement age who have said it's not worth it for them to stay.
She also worries about rural areas that don't have easy access to health care.
We have such barriers in West Virginia to healthcare access in general. And, instead of continuing our stringent vaccine mandates and offering solutions for parents and supports within the school system, which we do now, taking that away is really going to create some dire health outcomes for our community.
Wheeling, Ohio County Health Administrator Howard Gamble says West Virginia is one of the top states when it comes to vaccination rates in kids 5 years and older. But those numbers could drop if the bill passes, and then the concern becomes the possibility of rising numbers in diseases that haven't been seen much in recent years.
Right now, our vaccination rates in the state of West Virginia for K through 12 are pretty good. We're in the high 90s. Before you get into school, our vaccination rates drop down into the mid-80s. And if we watch what's happening in Texas right now with a large 100+ cases of measles, if you drop below a certain threshold of percent of your population vaccinated, eventually you're going to have cases develop.
I asked Wakim-Chapman if she had any concerns about cases developing in the future if vaccine mandates change, referencing the current measles outbreak in Texas.
You know, if this happens to, have an outbreak somewhere in a school around here, what would be kind of the contingency plan moving forward?
So the public health infrastructure is not being harmed in any way. We do have a reportable diseases mechanism through the department, and so that will be activated. And yes, it's terrible that there's a measles cluster in Texas. I believe that there's 90 instances of it, but there's also 28 million people in Texas. And so I think that we need to look at those numbers as well.
Right now, the bill is sitting in the House Human Services Committee in the advanced makeup stage. As this progresses, News 9 will keep you updated. Hi, I'm Jamie Baker. Thanks for watching. Here's another video for you to watch, and please be sure to subscribe to our channel.